start sharing more of what I'm actually seeing in clinic because this is where things get really interesting. This week, I saw a patient who's been a patient with me for about 6 months. She initially came in perimenopausal, dealing with chronic migraines, hip pain, and she also had a history of elevated lipoprotein A, which significantly increases your cardiovascular risk. For those of you who aren't familiar with lipoprotein A, this is a genetic lipid marker that can increase your risk for things like heart disease, stroke, and plaque buildup, even if your standard cholesterol panel looks completely normal. And the tricky part is, most providers aren't routinely checking for this. Instead of just focusing on one piece of the puzzle, we took a very comprehensive approach. We started with optimizing her hormones because she was clearly in perimenopause and dealing with a lot of symptoms. We worked on lifestyle, nutrition, sleep, stress regulation, and then we created a very personalized plan to address her cardiovascular risk factors and specifically target lipoprotein A. She initially came in, her lipoprotein A was 197, and I really like this to be less than 25. After 6 months of working together, we repeated her labs and it dropped significantly to 89. While it's not normal, it's definitely a significant improvement. Her hormones are now optimized, and the symptoms she initially came in with, things like migraines, poor sleep, and other signs of hormone imbalance, have significantly improved or completely resolved. We also have seen a meaningful reduction in her overall cardiovascular risk profile. This is why I always say, you can't just treat one symptom or one lab value in isolation. You address the body as a whole, hormones, metabolism, inflammation, lifestyle, you start to see things really change, and these are measurable changes. If you've been told everything looks fine, but you're still dealing with symptoms, or you're concerned about your long-term health, there's always something more to look at.